All right. Good evening, everybody. Thank you so much for joining us. My name is Ananda Lennox. I am the coordinator for the West Springfield Care Coalition, and I'm here tonight with our 5 panelists and moderator who are going to provide time to answer questions on anything you want to know about safe storage and why it's important to talk to your children about medication safety and also locking up alcohol and THC products. I wanted to let you know that for the evening, those of you who submitted questions beforehand, we already have those queued up. If you haven't had a chance to raise a question, pose a question, and you want to pose one during the evening, feel free to use the chat box. We can't see or hear you, so you're not going to be visible during this, but the entire webinar is being recorded so that we can share it later with a greater audience. And I wanted to thank everybody who showed up tonight. The panelists are all volunteering their time, and Ray Herschel, our moderator, has had a long and illustrious career in television, and he's going to be the MC for the evening. And let's see if there's anything I'm forgetting before we go out. Oh, at the end, I believe it's going to go out tomorrow. We do have an exit survey, and it would really mean a lot to us if all the participants would fill that out, because it really helps us fine-tune the offerings that we make to the community. So without further ado, Ray Herschel, if you could kick us off. Thank you.
Thank you very much, Ananda, for that kind introduction. And I just want to take a second before we start, just to thank the Care Coalition for its invitation to serve as your moderator for this evening's important community discussion. We're going to be focusing on the dangers within our own homes and in our own medicine cabinets of medications and other drugs that are often too easily accessible to young children and teens. Just how dangerous they are and what can we do to make our teens and young people safer are just a couple of the questions that are going to be answered by our panel this evening. Now, our panel of experts comes from different backgrounds and areas of expertise within our community. I'd like to briefly introduce them, and as I do, give them a minute just to tell us a little bit about themselves and why they feel it's important to be a part of this panel and discussion this evening. Our first panelist is Dr. Holly Perry, a pediatric emergency room doctor at Bay State Health Systems. Dr. Perry comes with a particular interest in toxicology and poisoning. Dr. Perry, welcome, and tell us a little bit about yourself, if you would.
Yeah, great. Good evening to everybody. So I was really interested in being part of this panel because every day in my work, I see families and kids who are either struggling with addiction, who've come in following intentional overdose, or sometimes for the young kids who come in following an exploratory ingestion. Most recently, we're seeing a big uptick with the edible cannabis. And so I thought it was important just to sort of be part of the discussion. So I'm very happy to be here.
Thank you, Dr. Perry. We're fortunate to have you with us this evening. Our next panelist is Mark Klee, a clinical pharmacist at Bay State Medical Center with a focus on issues related to pain and addiction. Mark, welcome, and could you say a few words about yourself, if you would?
Thank you, Ray. Greatly appreciate the opportunity to be here with you all today. Dr. Perry, a pleasure to meet you in the virtual sense. I sort of have the other side of the ED rather than the pediatric side, work with adults, and similarly, you know, one of the things that I focus on is how we manage pain and opioids within the hospital, and you know, also how we mitigate some of the harms from those. And then obviously as a pharmacist for some 20 plus years, medication safety and safe medication storage is something that is very important to me. So thank you again for allowing me to participate.
And thank you, Mark. Also joining us this evening is Captain Jay Gearing, a longtime member of the West Springfield Police Department. Captain Gearing, could you just tell us a few words about yourself and your presence here this evening?
Good evening, Ray. Thank you for hosting. Good evening to everyone out there and my fellow panelists. I appreciate this opportunity. I feel this is an important segment that the Care Coalition is providing on many fronts. First and foremost, I have a middle school child and a high school child, so this is near and dear to my heart. Secondly, I'm a 26-year veteran of the police department, serving the past 13 years in the Detective Bureau. And my current role is the detective captain, where I oversee criminal investigations, death investigations, as well as narcotics unit. So this is in the forefront of my job. I see this on a weekly basis. I see these issues on a weekly basis. And I think it needs to be brought to everyone's attention, the importance of safe storage.
Thank you, Captain Gearing, for joining us this evening. Our next panelist, Magda Cologne, is a community safety and outreach specialist with the Hampden County District Attorney's Office, who's committed to promoting health and public safety in the community. Magda, please tell us a little bit about yourself, and thanks for being here tonight.
Thank you for having me here tonight. So a little bit more about me is that I worked in the public health area and for Bay State for many years in the injury prevention arena. So when Ananda and the group called about this safe storage, the first thing that came to mind was growing and developing, out of sight, out of mind. And that was a campaign that was promoted a long time ago when young children and looking at medication and creating those healthy habits early on in life. And the other part of it was that conversation piece. When do we talk to our children about drugs and the opportunity of having drugs in the streets or with your friends and peers? So having these conversations, a long-term relationship between a parent and their child is very important to me as a public health professional. And I'm sure that to all the panelists today, as we dive into this conversation a little more. So thank you so much for your time.
And thank you, Magda. Also on our panel tonight, John Weiss, the president and owner of Ormsby Insurance Agency, who has a personal interest and connection with regard to tonight's subject. John, thanks for joining us. Would you like to say a few words about yourself and your situation?
Certainly, Ray. Thank you for hosting, and thank you to the other panelists, and especially thanks to everybody who's participating out in Zoom land. That's where it starts. It starts with you to spread the word. My family, my nephew is I guess you'd call it a recovering heroin addict that started with, drugs that were found in a medicine cabinet somewhere. So it's near and dear to my heart. I see it as an employer, people that we've had to let go and or terminate because of issues like that. And my big thing is, do not stick your head in the sand. Please do not say, it's not me, it's not my son or daughter, it's not my niece or nephew. That's the biggest mistake you can make. So starting this tonight is a great opportunity to discuss with other people in your family and other friends of yours. And the one message you should discuss with them is, please don't deny it. Please accept that it might be a possibility, and that's the best place to start. So thank you.
John, thank you for your time tonight, and thank you for sharing your story with us. Let's begin our discussion. I'd like to, first of all, ask a question to Dr. Perry and follow up a little bit on what she had to say when she introduced herself. Dr. Perry, I'm curious, what drugs and medications are children and teens taking that are sending them to the ER? What are you seeing in the ER with regard to these kind of overdose situations?
Yeah. So I think it's important to sort of divide what we see up into two very different groups. So you have the young kids who are just sort of exploring things. They find something on the carpet, they pick it up, they pop it in their mouth. What has been different since marijuana has been made legal in Massachusetts is that there are more edibles, and they look like food, right? They have the Nerds rope, they have the gummies, they have things that really look like candy and food. And so when you have a kid who's say 3, 4, 5, 6, they see it, they try it. Usually they have fairly high strength, and so those kids come in pretty sick. And so we have probably in the past 2 years admitted something like 25 kids to the intensive care unit after inadvertently getting THC, presumably edibles. And for the most part, the parents it doesn't even register. They don't know that their kids got into it. They didn't expect that they would. So that's been a big issue.
Dr.
And
Perry,
then, go ahead.
go ahead. I'm sorry to interrupt. Go ahead.
No, it's going to go on to the teenagers.
Go ahead. You can do that.
So with the teenagers, particularly with the pandemic, we've been seeing a lot of mental health issues, isolation, anxiety, depression. And I think that a lot of kids are turning to more drugs. And so what we have seen, we definitely have seen some kids who come in acutely psychotic after taking too much THC. But what we have seen more of are kids who are taking pills, and frequently counterfeit pills. So I've had a couple girls who say they took Percocet, but when we do the tox screen, it's cocaine and fentanyl. So we actually are seeing a lot of fentanyl in Springfield right now.
Serious problem for sure.
Yeah.
Dr. Perry, if I could follow up, we have a question from one of the members of the audience. And this is a question for yourself and also Captain Gearing. The question comes from Heather Warner, and Heather asks, nicotine vape cartridges are very toxic to children and pets if they find and chew on them. Have you seen this in the emergency room?
We have been fortunate not to see it in Bay State. There have been a couple deaths reported. There was a death in upstate New York. There's a death in Tel Aviv. So it definitely is, it is an issue, and it tends to be more of a problem for when people have like the little bottles to refill the cartridges, because then the kids, there aren't any sort of child resistant closures on them, and they can just get the nicotine, which is highly toxic.
Yeah. And Captain Gearing, from the police point of view, have police seen the nicotine vape cartridges in West Springfield at all?
Yeah, we do confiscate them from time to time off of children. The school resource officers all are equipped with testing kits. So, here and there they are confiscated on school grounds, and they're all tested to see if there's any legal substance within them. And so they're handled appropriately.
Thank you, Captain Gearing. I just want to remind those in the audience who are watching this evening, if you'd like to participate with a question for one of our panelists, for the whole panel, simply do so through our chat box, and that question will be relayed to me, and I can pass them on to our panelists. We do have a number of questions that have come in, and our next question comes from Kathleen Alvarez. And the question is, with confirmation your child has been using drugs, where do you turn? Who can you call? What programs are in place to help? In other words, where can people turn for help? I'll throw that question out to the panel, and whoever wants to give it a crack, go ahead, please.
Hi, I'd like to start. So I know that I represent also an organization called Learn to Cope. And this organization is specifically to helping parents and or someone who has a loved one who's suffering from substance use disorder. So the organization is learntocope.org. You could find a peer support group. This is parents that are going through or have been through the situation that you're facing. The space provides the safety, the confidence, the confidentiality to ask the questions, see what other parents are going through, and also have the opportunity to talk about what your experiences are and what their experience, and learn how these other parents have experienced, what they experience with their children when they suffer from substance use disorder. I will add that the information for learntocope.org, you could go onto their website and learn what kind of meetings they have, what days of the week they meet. Another suggestion would be to look at a website called Allies in Recovery. And Allies in Recovery has a set of tools that will teach parents or teach those caregivers to have conversation with your loved one. And as we know, when we're dealing with somebody that's suffering from substance use disorders or have some mental health conditions, those conversations can be very difficult, very, very difficult, because now we're all issues of trust, issues of where are you going, how are you with, and all these things will happen, very difficult for a parent to deal with. So Allies in Recovery provides you like kind of a set of tools to learn a method in which to talk with, using some all kind of different languages to move along those conversations that are very hard to have.
Thank you very much. Any other panelists have any other suggestions in terms of where a family, where individuals can turn from help if their child is experimenting with drugs and has a drug issue?
So Ray, there are a couple other resources. There are a number of community coalitions around. Quabog Hills Substance Use Alliance. Up in Franklin County, there's the Opioid Task Force. Hampshire Hope in Northampton that have some really great resources as well, and could steer people in the right direction. SAMHSA, which is the Substance Abuse and Mental Health Services, also has a website that has a number of resources, in terms of treatment and starters for discussions on their site as well.
Yeah, thanks, Mark.
Also, Ray, just what we're doing tonight, Care Coalition. If you just Google Care Coalition, they're all over the country, and every Care Coalition's goal is to reduce the consequences of drug abuse, alcohol abuse, vaping abuse, etc. So there's numerous websites within Care Coalition that will help you and direct you. And don't be afraid to ask friends. A lot of parents think if they ask a friend, then it's going to be like, well, my son or daughter has a problem. Well, ironically, most of the time people know your son or daughter have a problem already, and they should be telling you that, but they're afraid to tell you that. So don't be afraid to ask friends and families where you can find some information. Because like I said earlier, they probably know there's an issue happening already.
John, yes, go ahead. I'm sorry.
As a pediatrician, I would put in a pitch to really start talking to your kids when they're young. Like, don't wait until they're 14, 15, and they already think they know better than you, and they maybe have a substance abuse problem. Start talking to them when they're 9 or 10, and just like get the conversation going, and hopefully that will avoid things, or if things come up, you have a better framework to have the discussion in.
Thank you. And we have a question just submitted by Katie Howard, and it kind of follows up with this discussion about getting help for families. She asks, are there any local or online counseling options for substance use disorder? Any local or online counseling options? Anyone know of anything like that?
So most of our organizations that provide mental health resources also provide substance use disorder resources. And today, COVID have changed our healthcare tremendously. So many of these organizations provide telehealth. So it's about talking to, whether it's BHN, CHD, MHA, all of the companies that will provide services will also have the availability to provide those services via online or telehealth.
Mm-hmm. Okay, very good. We have a question now that comes in for Mark Klee. Mark, the question is, what are some resources for how to properly dispose of medications? Can I just flush them down the toilet? So in terms of, disposing of medication safely, what's the answer?
There are a couple of really good resources, and what I'll do is I'll put these in the chat. One is from the FDA that has a couple of different options. They have a flushable meds list. Universally, we don't recommend that people flush their medications down the toilet, because some of those can get into our water supply. septic systems can, they don't filter out these medications. And some folks may remember a number of years ago where they were testing the water and they were finding fluoxetine in it, which is an antidepressant. And just a couple of quick ones. The Drug Enforcement Agency twice a year has a National Take Back Day. Typically, these occur once in the spring and once in the fall, where people can bring their medications in and dispose of them. Now there are the next one will be kind of a more local in Massachusetts. Through DPH has a website where there are permanent kiosks that you can return medications to. Bay State Medical Center, any of our community hospitals at Wing, Franklin, and Noble will have these as soon as you walk in the door. And essentially these are drug disposal. You go over, it's like returning a book to the library. You open it up, you put the meds in, and you're done. But this Massachusetts website lists where these permanent drug take back kiosks are located. As I think about West Springfield area, I think there may be one located at the police station. Yeah. Some local, and this has always driven me nuts, is that you couldn't bring medications back to the pharmacy. They're the ones who are dispensing it. It seems only logical to me that you would be able to return drugs there. And what you're finding is that more and more of the community pharmacies are offering this at I think select locations. I don't know that it's universal. But they will have these kiosks where again you can return the medications. And so what I'll do is I'll put those two resources in the chat for folks.
Mark, when we refer to safe storage, what does that mean in terms of people at home with their medications and their drugs? How can they safely store these drugs that are not in the reach of young children or teens in the house?
Yeah, there have been some interesting studies that have come out taking a look at, and this is kind of focusing more on opioids and post-surgical prescribing, but they also take a look at and speak with patients about, how did you store these medications? How did you dispose of them? And I think on the order of and again, this is focusing on opioid prescribing after surgery. Only about a quarter of people had their medications in a secure, locked location. The other 75%, were, either on the counter, they were stored in an unlocked medicine cabinet, where anybody who would be accessing the bedroom or the bathroom or wherever they were would have access to those. I have a visual that I like to show folks. This is it's a medication lockbox, and they cost about $20. You can get them at just about any pharmacy. And particularly if you have controlled substances in the house, these things are, I think, fabulous to have. They're not the sort of thing that are impenetrable. They're not designed to be. But what they do is if somebody has tried to access the medications, there's clear evidence, that the hinges are off. They have similar things that like deposit envelopes, with a locked zipper on it, so that you can tell that the medications somebody has tried to access them. And to me, those are some of the best ways, and certainly kind of keeping them up and away, and it not letting a lot of folks know that, what your medications are, where you store them. and kind of keeping track of how many you have, I think is another good suggestion for people, so that you can tell if somebody has been, taking the medication.
That's another
and
point.
disposing, getting them out of the house once you're done using them is also critical.
That's an important point to bring up. I mean, how do we keep track of the meds? If you have a lot of meds in the house, and how do you keep track and make sure that somebody is not accessing any of those meds that you're not aware of? So you've got to be diligent, I guess, about counting the pills and making sure that nothing is disappearing.
Ray, if I could just expand on what Mark said, the West Springfield Police Department has a kiosk 24/7 in our lobby. And like he said, it's just like returning a book to the library. It's as soon as you walk into the lobby, it's right there. You don't have to interact with anyone. You don't have to tell anyone what you're doing. You just come in, use the kiosk, and you can walk out. It's a very simple and private process.
No questions asked. It's that simple. Just come in, drop them off, and leave.
Exactly.
Yeah,
I'd also like to remind people that you always have the option to do a partial fill, which is particularly important post-surgery, because sometimes people will prescribe like a 30-day supply of narcotics when you really don't need it. But Mark, what I don't know, if somebody does a partial fill and then they decide that they need more, can they fill the rest of that script, or does it get destroyed?
I believe they can, so what would happen is they would document on the script, how many were picked up.
Okay.
And to the best of my knowledge, they could still go back and access the rest of those if they needed to. Again, if you get that 30-day supply, like Dr. Perry was suggesting, and you only use 50% of it, and again, that's kind of what the studies say, is that anywhere from 2/3 to 90% of people who have surgery have opioids left over afterwards. And again, the pill counts as well, at least 50% of those left, and those sit in the medicine cabinet. And those medications serve as a reservoir for non-medical use. So again, it's don't save them for future use. I might need them in the future. Get them out of the house. Get rid of them.
Okay, thanks, Mark. John, could I just bring you back in the discussion again to follow up a little bit on the story with regard to your nephew and how his problems began, and was he able to get the help he needed? We talked about where families can turn to for help in this sort of situation.
He has been able to get the help he needed, but the issue is it's a struggle. My nephew came from an upper middle class family, college graduate, owned a home, very successful, but it's a disease that even with all the help he got, it is still an everyday struggle. So they were able to access help, but the best that could have been done is that it never would have started, and it started back many, many years ago. And no one can really put a finger on it, but I believe it was from accessing drugs in other people's medicine cabinets. Mm-hmm. So I go back to the point that you think that your son or daughter isn't going to do that, but you don't know every one of your son or daughter's friends, so they come to your house and they use a bathroom, and there's narcotics in that bathroom medicine cabinet, and maybe your son and daughter didn't take them, but one of their friends did. Also, you have a few couples over for dinner. You have no idea one of those couples had surgery 8-10 months ago and enjoyed that narcotic. And they open up your cabinet and there's some from your old surgery. They take it, a few. They leave it in their kitchen counter, or they leave it in their glove box of their car. Their kid finds it. So it all comes back to protecting those narcotics while they're in your home, or getting rid of them we don't need them any longer.
Magda, could I just ask you a question that has come in, and this is regard to speaking to our children, our young kids, about the potential dangers of drugs and then medications and so forth. There are parents out there who might be watching this town meeting this evening saying, how do I go about talking to my kids about medication safety? And, you know, when do I start? How young, what age? What advice would you have to them?
So I would say, Dr. Perry just alluded to that earlier in the conversations. The earlier, the better. And I would think about being responsible with our medication and treating medication with respect and kind of building those layers of protections and having those conversations early on. Like I would say, you know, from the beginning, grandma's medication is grandma's medication, not for you. It's for her and for her heart. For you, it's very dangerous. And move on to the next level of conversation will be, you know, you have a headache, you take the amount of medication that is supposed to be for you and your age and your, you know, the time of the day or the how many times a day that you need to do it, not more than that, because that's what it's meant to be doing. So as parents, to having those conversations often to make sure that our kids will become responsible for their meds. And then when it gets to that curiosity time, right, those teenager years or the earlier teenager years, when we talk about other stressors, or I want to be popular, so my friends are exchanging pills, so I'm going to do the same thing too. Let's have those conversations with our kids beforehand and have that open conversations. I like the quiet times, like the driving in the car. There is nobody else in the car but me and my son, to have the opportunity to have the conversations about what's going on at school. You know, is there anything that you need, that you think I need to know about what's going on? And having those normalized conversations, that is not hiding it away, like our panelist, Mr. Weiss, was talking about, just out front in person, just saying those, confronting the situation, being very honest about the reality of substance use disorder, how true it is and how much it damages people. One of the things I used to always like to say to the kids that I work with was, a simple decision that you make today could change your future forever. And so to make those decisions responsibly and continuing to make those decisions responsibly would broaden up your future. And so it's easier to make amends as you move on. So to all the parents out there, I will tell them, sooner, punishment aside, have a conversation very honest, have a conversation that provide options. You could tell me, you could tell mom, you could tell a friend, you could talk to somebody. We're here to help. And moving away from that punishment side when you're starting talking about this. This is something that we talked about being an illness. We talk about it being very dangerous. And so we have to provide, and we should provide the space for that conversation to happen naturally and safely.
Yeah. And when your children get older, Captain Gehring, you had mentioned, I think you have one child in middle school, one in high school. When the kids are older, of that age, how do you talk to them about drug and medication safety?
So I don't know what the right answer is, because I in my position, I see this affecting all aspects of all socioeconomic levels. But a lot of times it's what I don't say is what I think gets across to them. Many times I'm called in the middle of the night for a drug overdose, and my wife has to explain why dad's not at breakfast, and that gets the you know, the dialogue going. And then I come home and I explain what happened. I tell my kids, and I think it's very poignant. I stole it from someone, I don't remember who, but the hardest thing that they're going to do, I believe, along these lines is say no to their friends. And as Magda said, their friends are going to pass this, they're going to pass it. It's going to be, you know, someone close to them that they may see this. And the hardest thing is going to be to say no to their friends. And I try and really press that issue. And then again, I talked about my work experiences and how you know, what I dealt with, you know, in the middle of the night or the previous day, and why some decisions people made that were very costly.
We have a comment
Ray.
that Yeah, go ahead. I'm sorry.
Just quick, you know, I think we've had a recent sort of episode in the news in Connecticut, you know, that sort of emphasizes, you know, you talk about when you should start talking to kids. You know, a 13-year-old kid who died of what they think may have been a suspected fentanyl overdose. 7th grade, 13 years old. And I guess just one other point in terms of talking to kids is when we're talking about addiction, it's sort of a multifaceted, you know, the things that play into that, you know, psychosocial environment, genetics. You know, I have a family where sort of the drug of choice was alcohol. You know, my grandfather died of liver disease at a relatively young age. And there's a genetic component to this. And it's important that if our kids are at risk, they be aware of that and what some of the strategies may be to protect themselves. And one of the things that they can do is delaying trying these medications. You know, when you look at alcohol, there have been some studies that say that if you start drinking before age 15, your risk of having problem drinking later in life is like 4-fold that if you kind of hold off, just, you know, take some time and wait. And that's something that I've shared with my 2 kids. Hey, I know you're going to experiment, but what I'm asking you is, you know, your brains are still, you know, the circuitry is in process of being wired. You know, don't mess with that. Hold off as long as you can.
That is almost exactly what I said to my kids. Like, I know you're going to experiment. I never want you to do heroin and I never want you to do injectables, but I have to say that the fentanyl that is in our community is so scary, because I feel like we're seeing so much of it. It's just, you know, more potent than heroin. And we're seeing a lot of, Jay, I don't know if you're seeing how many overdoses you're getting, but like in peds, we see kids who are really, really affected, you know, a couple kids who've needed CPR and have come back with Narcan. But I think that a lot of it is just the fentanyl and they don't know what they're getting. They think they're getting one thing, they're getting something completely different.
Well, we have weekly overdoses that we deal with here at the West Springfield Police Department, and the fire department obviously deals with it as well. Now, when I use the word overdoses, that doesn't mean they all succumb to it, but you know, we respond to overdoses on a weekly basis.
Yeah.
So one of the things that I tell all the time, that I talk to groups all the time, is this idea of press pills. And so the conversation is, if you have a headache and you think that you're going to take this pill, just take it from the package that says, you know, Advil or whatever else. Take it from the container that you buy at the store yourself. Not trust your friend to bring it over and say, oh, I have some painkillers here. Share those, because we know that they might just be counterfeit and not what they're expecting to be taken. So those conversations, to have it on a regular basis, are very important with parents. And if you have a news like this, you have the 13-year-old family who lost the 13-year-old that was lost not so long ago, they have those conversations. I know it's very hard to have discussion like this, but with something happen like that, capture the opportunity, I would say, to talk to your children about what's going on, the reality of what's going on. Thanks.
A couple of questions that have just come in also. This is kind of a follow-up, I think, to what John was talking about a few minutes ago. This comment comes from Karen, and she says, I have a friend in real estate, and this is an issue that comes up too, drug seeking during open house. So as you said, John, you know, these drugs can be accessed from medicine cabinets from a variety of different people and sources. And here it is, a real estate open house, and people are taking drugs from medicine cabinets. So if it's accessible, it could very potentially be a major problem.
The one point I want to make, I'm going to ask everybody, you know, the panelists as well as the participants, would you ever take $20 bills and leave them in your medicine cabinet. You'd say, that's crazy. Of course it's crazy, because some of those $20 bills will be missing fairly quickly. So why are you doing the same thing with drugs?
Good question. Why do you think most people are not locking up their medications? They don't think that they could be accessed within their own homes, either by their own children or friends coming in or other people going through the house. Why aren't more people locking up their meds? Any thoughts?
I think it's just, it has to be made known. I mean, I think this is a good forum to do that. I hope a few people say, really, yeah, that's, didn't realize that. Open house, or a neighbor or a friend of a son or a daughter, the $20. You would never leave that kind of money in your medicine cabinet. So why leave drugs? Just be smarter. It's going to help everybody.
There was a survey done, and this goes back a few years, but kind of surveying people who inject drugs. And I think when I was growing up, cannabis was sort of what we were told was the gateway drug. When in fact, what this survey found is that on the order of like 80% of the people who were injecting drugs started off using prescription drugs. And at least half of those got those drugs from family and friends. So either going through the medicine cabinets or, oh, you've got pain, here, I've got some Percocet, and we're given to them.
Yeah.
Another question.
I believe, Ray, I believe there's a paradigm out there amongst a lot of people, and that it's just that's not, these problems aren't going to enter their world. And this isn't effect. This only happens to other people. And as someone who's been doing these investigations for many years, it's heartbreaking that I can't say it enough, that it just reaches all over the community, all areas of town.
By sticking your head in the sand, the problem's not going to go away. Just by hiding from it doesn't mean it's solved.
But I also think that, teenagers are pretty good at holding things in, and parents don't necessarily recognize that there's something going on, which is why it's really important to limit access and to try and talk to them and try and get out what you can.
Get that information out. A question comes in from Burke Joanne. I know we don't have a member of the school department on our panel this evening, but perhaps some of our panelists are aware of this. She asked, is there a substance abuse curriculum in the schools? In other words, are kids taught this in the schools about the dangers of substance abuse?
So the school resource officers, I can't speak to the teachers in the curriculum, but I know the school resource officers, there's one at the middle school and there's one assigned to the high school, as well as the collaborative school on Brush Hill. They all have curriculums that they do, and they actually do an educational segment with the students. It may only be 2 to 4 weeks out of the year, but I know they touch base on it on different levels.
So they're aware of it. It's interesting. We are getting a number of questions coming in from comments that are made by our panelists. So people are listening out there. And once again, we want to remind folks, if you're watching and listening out there, and you do have a question for our panel, you can go through our chat box, submit that question, and we will get to as many as we possibly can this evening. One question just came in from Ann Talley, and it kind of dovetails to what we have been talking about locking medication. She asks, how can we encourage behavior change for people to start locking their meds after they have been educated on the topic? What kind of messaging can we use that will be effective? In other words, how are we going to convince people to actually lock the meds, even though they are educated as to how potentially dangerous it is to keep their medicine cabinets unlocked.
$1 million question.
Yeah, I mean, I think that's what we're trying to do.
You know, Ray, sometimes legislation, you know, we don't do things until we're forced to do it. You know, certainly when we talk about patients with cancer or who are receiving chronic opioids, one of these little boxes, you know, $20 dispensed along with that, I think would go a long way, you know, towards helping secure these within homes. But again, you know, sometimes it takes, you got to do it, you know, rather than it being a choice.
Well, we hope that.
Excuse me, Ray, do you think there's an opportunity that as a coalition that we could inquire with all the health insurance carriers that a box like Mark alludes to is now a prescription quality, refundable, reimbursable event? So you go and you pick up, you know, a script of opioids and it costs you a $7 copay because you have really good insurance. You can't get it unless you get a drug box with a $10 copay. And now every time you fill a script that's a narcotic, you get one of those drug boxes with the script. I mean, that's a grassroots event that you take up through your legislature, and hopefully we can get that through. That would be a great opportunity for the CARE Coalition, the DA's office, health community to get behind.
I agree.
And I think that you would find that it's cost effective too. You know, I mean, if you think about what does an overdose cost? You know, if the patient ends up in the ED or they get admitted or, you know, ICU care, just one episode, you know, I think that would be cost effective.
Just as an incentive, perhaps for people to think twice about this and perhaps locking up their medicine cabinets, the CARE Coalition here in West Springfield, which is sponsoring our discussion this evening, is going to be offering a before and after social media challenge. And basically what this involves, they're going to be asking you photos of your medicine cabinets before locking up and then after, and then they will be awarding prizes through a drawing just to step up the challenge and perhaps make people think twice about this and maybe give them a little incentive if they want to get involved here and win a prize for a before and after picture for, you know, before locking up your medicine cabinet and then afterwards. So that's something the CARE Coalition is going to be taking care of and asking you post this particular discussion this evening. Very interesting thoughts. We certainly appreciate them. I just want to get back to Dr. Perry for a second. Dr. Perry, we talked about some of the meds and some of the overdose problems that you've witnessed in the emergency room. What's one of the worst cases of substance exposure that you have seen among kids or teens in your capacity as an emergency room doctor?
So I think probably the most upsetting one I've seen is I've taken care of 2 kids twice in the period of 2 weeks who overdosed, who needed Narcan both times. One time, one of them needed CPR. And both of these young people were completely unconcerned and didn't think that they had a problem. And that was really, really frightening for me because my concern for them obviously is either one time they're gonna, somebody's not gonna be there with the Narcan and they will die from their overdose, or that they will end up as having opioid use disorder. And it just sort of feels like a train, you know, a train crash that you can't stop.
Are we as a community making any headway with regard to combating the substance abuse problem? We continue to discuss it and discuss it and discuss it. Is it getting more critical, more serious? Are we making headway? Or are we making some progress in combating substance abuse among our neighbors and in the community? Any thoughts?
I actually think that we are making a small amount of headway, in the sense that over the past 5-7 years, the kind of legislation that has gone out about opioid prescribing, the kind of education that physicians are getting about how you really should try and limit opioid prescribing, like, I think that there are a lot of things that have been done to try and decrease opioid prescribing, but there are a lot of people who are already, unfortunately, in the pipeline and who already have substance abuse problems. And there will always be people, in large part because of the genetic predispositions. So I think we've made some progress, but it's still just a overwhelming problem, and the pandemic has just made things that much worse.
Yeah.
Yeah, and I just to sort of drive that point home, is the last month the CDC, in sort of their preliminary numbers for overdose deaths, has for 2021, they're sort of anticipating more than 100,000 people in the U.S. have died from a drug overdose, and 3/4 of those related to opioids.
Yeah.
I mean, that's an extraordinary number. And I mean, when you compare it to the previous years, it's like on the order of 24 to 30% higher. I don't want to end on that, because when you talk about positive things in our community, expanding access to naloxone, which is an antidote for opioids. There are a number of organizations and groups that are trying to get this into the hands of people who need it. I think at Bay State Medical Center, we distributed, I think, like 300 kits last year out of our emergency department for people who came in with opioid use-related disorders. So we're working on it, but still, as Dr. Perry says, we've got lots more to do.
And I don't know if the CDC looked into this, or Jay, if you have any sense about this, but I do sort of wonder how much fentanyl and sufentanil and the more potent opioids are sort of contributing to the excess deaths, because I just feel like they're just everywhere.
Yeah, and I think you touched on it with the fentanyl. Lots of times, obviously, the medical examiner assists in our investigation, and the quick talks that they do, we often see heroin, fentanyl, right off the bat.
Yeah.
So I think, like you just said, it's everywhere, and it's a real problem.
I think one thing that is important to mention is that naloxone, Dr. Klee is talking about, is available, and Massachusetts has an open prescription, which means that anybody who goes to a pharmacy, anybody that suspects that they need Narcan to be at their home, could go to a pharmacy and ask the pharmacist for it. You could charge your copay like an insurance company, from your insurance company, but it's an open prescription. So we have many organizations that are providing naloxone free, that provides the education for families free. And you could get it by yourself, going to your local pharmacy and saying, I'm here for naloxone, and there's an open prescription for it.
So I wonder what people feel about, like, particularly prescribing it or having it in the house when they're young children, just from the sense that sometimes there's this feeling that you actually are enabling them, and you are making it so that they feel safe and are more likely to use. And I don't know if anybody has any thoughts about that.
Well, in my situation for my nephew, it's always an opportunity to give them another chance.
Mhm.
It's not as if he knew that that opportunity is there, but his parents made sure that opportunity was there with the understanding and the hope he has another chance.
Yeah.
John, I think that's a great point. One of the analogies I like to use, when talking about opioid use disorder, is that when you talk about smoking, the CDC says that it takes anywhere from 9 to 11 tries before someone is successful in quitting smoking. And sort of the understanding that this isn't easy. If it were easy, we wouldn't have this problem. The primary difference, of course, being between tobacco and fentanyl is that a one-time relapse can kill you, with opioids. But I think yours is a great point.
I also agree with that. That was just very well, beautifully said. When there's life, there's hope, right? And if we have the opportunity to bring somebody back from that, the symptoms of an overdose or that borderline into not being here anymore, I think is worth the having that available. And also, I was looking at a research not so long ago that it also takes about 8 to 10 times maybe for a person that's really serious about their recovery to get to recovery. So this is something that's going to be with us for some time. That first time is not, the second time may not be, the third one maybe, but if we have Narcan available to us to help that process and help that conversation happen, it's better not to have it than not have it, and then not provide that hope and that opportunity for that individual. And today we have all the stress pills and all this access to that we don't know what is in the access to, right? We have so many drugs out in the community that we don't know what the making of it is. We're thinking that might be a Percocet, but it might have fentanyl and enough to kill you. So we don't know that. So having Narcan available might be of help in those cases that we don't know.
Mm-hmm.
See the Narcan and a lot of calls that we respond to. I mean, a lot of people have it now, but it's not fail-safe. We recently did an investigation of a death where the victim had the Narcan in their hand and succumbed to an overdose. They just couldn't get to the Narcan fast enough. So
yeah,
it's a nice resource, but along with the doctor said, sometimes we wonder if it makes them feel a little safer doing their drugs with the Narcan, which shouldn't be.
Yeah,
I've been sort of doing a little bit of looking at folks that were distributing the naloxone too, as they come to the ED with overdoses, and taking a look at pre-hospital Narcan. And in looking at like 100 cases, one of the things that I found really surprising was that it was almost a 33 split. That about a third of the patients got their Narcan from police, who are oftentimes maybe the first people on the scene. The other third, and probably a little bit more, got it from EMS. But what I found really surprising was about 30% received Narcan from a bystander before first responders arrived on the scene. To me, that's extraordinary. And it tells me that the naloxone that's being given out by the various organizations is getting into the hands of people who need it.
mm-hmm.
Fascinating discussion from our panel. We have just about come to the end of our time. As we do, I would just like to ask the panelists individually if they could just give us their final thoughts. Is there anything that wasn't brought up this evening you feel is relevant to the subject we were talking about that you'd like to express right now? What are your final thoughts, and what's your message to the community? And I'd like to go down our list of panelists. Dr. Perry, could we begin with you? Any final thoughts as we close?
Yeah, I don't have anything really new to offer, but I would just reiterate the importance of not having narcotics in your house if you don't need them, and getting rid of them when you're finished with them, so they're not a temptation. And also just talking with your kids early on about drug experimentation and drug use.
Mark Klee, your final thoughts and message to the community as we get set to wind down?
I would echo Dr. Perry's comments about talking to your kids. I have soon to be 11-year-old twins who have two pharmacists as parents, who probably hear the conversation almost on every car ride, you know, whether it's the hockey practice or it's important that they hear our voice, that they know our expectations. There are going to be lots of other folks that are offering their opinions. And it's important that we take the opportunity to have our voice heard in that conversation. And again, just the importance of securing those medications, locking them up, and getting rid of them when they're no longer needed.
Thank you, Mark. Magda, what would your final thoughts, final message be to our community this evening as we get set to close?
Yes, so this is an amazing group. I've learned so much from all of you at this panel today as well. But I will go in the same lines, just open conversation, factual conversations. Don't miss, as a parent, don't miss an opportunity to have that discussion with your child. If you don't have the answer to a question, search it. There's many places in which you could search for that right answer for that conversation or that question that your child has for you when you talk about substance use disorder, when you talk about the drugs that are in the house, when you talk about the reasonings why you don't want them to start any of the other drugs, or any curiosity that they might have. SAMHSA, Allies in Recovery, Learn to Cope is here available. There's a lot of resources out there at your fingertips. Please use them, and just look for your drug-free coalitions, like the CARE coalitions, for more information.
Thank you, Magda. Captain Gearing, any final thoughts of your own for our community this evening?
I just want to reiterate what all the panelists are saying. Dialogue with your children and the safe storage, how important it is. If you don't think it's going to happen to you, you're gravely mistaken. I've done death notifications of transient homeless people on this topic, and I've also stood in the kitchen of $1 million home and done a death notification. And it's happening way too often. Just one other thing, Ray, I'd be remiss if I didn't mention the Section 35 law in Massachusetts. It's in extreme cases, but it's very useful. It's where a qualified person petitions the court for help and gets court-ordered help for someone that's suffering from substance abuse. Physicians, police officers, blood relatives, spouses are all qualified to petition the court, and then the judge will hear the case and order treatment as needed. And oftentimes that's a last resort, but it's very useful at times, and we see it a lot in our line of work. So I just want to thank everyone for tuning in tonight.
Important point to bring up. John Weiss will give you the final word tonight as a member of the panel. Your thoughts, John, as we conclude tonight?
Just like I reiterated early, that don't stick your head in the sand. It's not going to go away. Don't be ashamed. Have an open conversation. And Ray, you had mentioned a few moments ago about, do you think we're making headway with any of this? And this evening is headway. If everyone on the panel and if every participant who dialed in or logged in could ask themselves and ask a family member and ask a friend to do something about it, discuss what you heard. Hopefully you've learned something. But again, you know, it's an opportunity to move forward, to have our individual community move forward, and it's a plus. And thank you all for being part of it.
And thank you, John. Thank you to all our panelists. And with those closing remarks, we will conclude our virtual town meeting here in West Springfield. On behalf of the West Springfield Care Coalition, I'd like to thank all our panelists for an engaging and enlightening discussion this evening. You were all great and brought a lot of important information to the forefront here for our community. I want to thank those who organized this event this evening, the Care Coalition, for all their hard work in putting this together. And certainly, last but not least, I want to thank our participants, our audience out there online who have watched and participated with some very good questions to our panelists this evening. We'd appreciate your filling out the survey, which will be emailed to you. It helps us in putting together future programs that are helpful to our community. Once again, thanks for joining us. I'm Ray Herschel. Take care and please stay safe.